Hi, I'm Dr. Kevin McCurry from Whitney, Plaza Dental. Welcome to episode 2 of Need to Know. Thank you for joining me. In the last episode, we talked about how to brush effectively. If you missed it, please go back and watch episode 1. Today, we're going to talk about the rest of the story because brushing it by itself is not enough. Let's start with flossing. Yes, you should floss daily, but more importantly, you need to floss correctly. Most people either skip it, and yes, we can tell, rush through it, or do it incorrectly. Consistency is important, but your technique really matters. Gentle is the key. This is not a power move. Here's what works. Gently slide it between the teeth. Wrap it around the front tooth. Move up and down. Then wrap it around the back tooth. Same contact, both teeth, then move on. No snapping down, no sawing, no shortcuts. Not all the floss is the same. Different situations need different tools. Tight teeth, you could use wax floss or glide floss. Normal spacing, unwaxed floss or standard floss. Hard to reach areas, you could use a floss holder. Bridge work, floss threaders or even super floss. And then large spaces or large fingers, you can use dental yarn or tape. If you're not sure, ask your hygienist. They should already be helping you with this. If not, why not? Now let's talk about the extras. Proxy brushes, perioades, oral irrigation. These can all be helpful, but only if you understand their role. Proxy brush is like a mini bottle brush, and a perioade is a handle that holds a small cleaning tip, like a round or square toothpick. Both of these tools need special instruction, or you could be making things worse. Your dentist or hygienist will recommend these if your situation calls for them. An oral irrigator is another tool, but it is not a replacement for flossing. And even it's not a replacement for brushing. Think of it like washing your car. The oral irrigator is like hosing it off, and just as messy. It does remove the big debris, but if you stop there, there's still a film left behind. Same thing in your mouth. That film is bacterial biofilm. To remove that, you need physical contact, and that means floss or brushes done properly. Here's something I've learned over 37 years. If I give patients too much to do, then none of it is done well. So let's keep it simple. Master the basics first, then add tools if needed. Different tools, different jobs. You just have to use the right one. Mouthwash is another area of confusion. Not everything in a bottle belongs in your mouth, and not all mouthwashes do the same thing. Some help, some don't, and some just make you feel like you did something. Many people think it replaces brushing and flossing. It does not. At best, it's a supplement, not a solution. Some even argue that it kills all the good bacteria in your mouth, which we need. So it might actually be a negative. You decide. Now let's talk about something people notice quickly. Staining. Coffee, tea, red wine, tobacco. They don't just stain your teeth, they affect your overall health. Tobacco in particular is one of the most destructive habits for your health. It increases gum disease, bone loss, tooth loss, oral cancer risk. This isn't cosmetic. These are just the oral dangers. This is very serious. Don't start. Just stop. Now let's connect this to something else that is important. Gum recession. Most people think it's from brushing too hard. Again, possible, but not probable. Yes, hygiene plays a role. Infection does cause bone loss, and the gums follow. But what if your hygiene is good and you still have recession? This is what most people never hear about. Occlusal trauma. Think of a fence post. Push straight down, it holds. Rock it side to side, it loosens. Teeth are the same. They tolerate vertical pressure. They do not tolerate tipping forces. Direction matters. Clenching, grinding, bite problems, they torque the tooth. Bone breaks down, the tooth loosens, the gums follow. We're going to talk more about this in the future, but next time we're going to talk about the stories people tell themselves about their teeth that simply aren't true. If you'd like to learn more, visit whitneyplazadental.org. Thanks for watching.